it is a fresh month of May, and we're talking about a series of testicular conditions that can contribute towards erectile dysfunction or any form of sexual dysfunction. Let's talk about number one, which is varicocele. Varicocele, as I previously described before, it's like a bag of worms inside your testicle. Not a physical worm, but the actual vessels, the veins that's dilated that looks like a worms. If you imagine that men and women can get varicocele of their legs, and varicocele of the testicle can also exist. And that itself has two problems. Number one, it obviously is a bit uncomfortable because the excess amount of blood will cause a dragging sensation of the testicle. Number two, it also will influence the temperature inside the scrotum. The scrotum is designed to be 1 degree lower in temperature compared to the rest of the core body. As a result of that, it will optimize sperm production and also testosterone production. Although we have discussed the consequence of higher temperature of the testicle as far as fertility is concerned, but there are very few studies to suggest that when there is varicocele, is there any form of sexual dysfunction. In fact, a Taiwanese study has looked at more than 100,000 men and she realized that varicocele happened between 3 to 15% of general population, and 40% of men with infertility will have varicocele. And out of these 40%, about 30% of men who has got varicocele will have problems of lower sex drive and also erectile dysfunction. In fact, we don't really know what causes it, but the most obvious reason why is that when the testosterone is lower, then men will suffer from erectile dysfunction. So, will the reversal of varicocele actually improve that? In fact, there are some studies to show that improvement of the varicocele, the rectification of varicocele definitely will improve the sperm quality. And the operation to reverse the varicocele also improve testosterone, and men with erectile dysfunction suddenly have that resolved after the operation. For the following week, we're exploring another form of testicular abnormality contributing towards erectile dysfunction or sexual dysfunction. We're going to talk about inguinal hernia. So, will inguinal hernia affect your sex life? You need to know. You stay tuned for next week's Putting Dr. G on the Spot.